India's Prime Minister Narendra Modi announced a complete lockdown in India for 21 days. It was shocking. But what were the reasons behind this? Why did Modi did this? What are its necessity? We will provide you complete details on the issue. So please be in the video till the end so that you get every news. Before starting the video, make sure that you have subscribed our channel. The coronavirus comes in 4 stages. Stage 1. In the first stage of a disease epidemic that eventually takes the form of a pandemic, cases are imported into a country in which the infection did not originate. This means that the person containing the disease will spread the virus to other persons. Stage 2. The second stage is when the virus starts being transmitted locally. Local transmission means that the source of the infection is from within a particular area, and the trajectory the virus has taken from one person to the next is clearly established. Stage 3. The third stage is that of community transmission. According to the World Health Organization (WHO), community transmission is evidenced by the inability to relate confirmed cases through chains of transmission for a large number of cases, or by increasing positive tests through sentinel samples, routine systematic testing of respiratory samples from established laboratories. In layman terms, it means that the virus is now circulating in the community and can infect people with no history, either of travel to affected areas or of contact with an infected person. If and when community transmission happens, there might arise the need for a full lockdown, because in that situation, it is theoretically possible for every person, regardless of WH. India is currently in third stage. Stage 4. There is also a fourth stage in every pandemic. It is when the disease, COVID-19 in this case, becomes endemic in some countries. The Indian government's containment plan takes this possibility into account. Among diseases that are currently endemic in India, meaning they occur round the year across the country, are malaria and dengue. Researchers are well on their way to discovering vaccines and treatments for the virus, but even in a best-case scenario, these are likely to be 12 to 18 months away. Until then, extreme social distancing is pretty much the only intervention available to help individuals stay healthy and to break the chain of transmission, giving more vulnerable populations a fighting chance of surviving this pandemic. But how exactly does a lockdown work? And why is it important for even younger and healthier people who face a lower risk of severe illness to remain in their homes as much as possible? The goal? R is less than 1. The purpose of a lockdown, explains a new study from the Imperial College London COVID-19 response team, is to reduce reproduction, in other words, to reduce the number of people each confirmed case infects. The goal is to keep reproduction, or R, below 1, with each case infecting fewer than one other person, on average. The authors of the study say there are 2 routes to try to get there. Number 1. Mitigation. Slowing but not necessarily stopping epidemic spread, reducing peak healthcare demand, while protecting those most at risk of severe disease from infection. This is done by isolating suspected cases and their households, and social distancing the elderly and people at highest risk of serious illness. Number 2. Suppression, or basically, lockdown, which aims to reverse epidemic growth, reducing case numbers to low levels by social distancing the entire population indefinitely and closing schools and universities. The study's models show that, painful as lockdown may be for many of us, it works. Without any lockdown or social distancing measures, we can expect peak mortality in approximately 3 months. In this scenario, 81% of the UK and US populations would be infected, with 510,000 dying in the UK and 2.2 million dying in the US. In contrast, isolating confirmed and suspected cases and social distancing the elderly and vulnerable would reduce peak critical care demand by 2/3 and halve the number of deaths. To get closer to the goal of R less than 1, they say, a combination of case isolation, social distancing of the entire population, and either household quarantine or school and university closure are required. I hope that you have understood why lockdowns are necessary during pandemics. Thank you for watching the video. Be sure to subscribe our channel and hit the notification bell. Like and share this video so that every people know about this. Thank you.